Welcome to the Be Well for Life learning series. We're going to be talking about ways to improve your health and ways to maybe just tune up things so that you can feel better and enjoy the best health that we can have. So I'm going to give a little bit of an introduction here to our first part of the series about how the program works. Taking care of our health, you know, is a personal responsibility, isn't it? And to do a good job, there's two things we need to know. One is the knowledge about how to live healthfully, and then the second thing, of course, is putting it into practice. Opportunity to try out some of these things and see how it works and incorporate them into our lifestyle. So it's the goal of this series to help acquaint you with the research that links to the very best studies on how to improve your health, how to prevent disease, how to live a longer life, and basically just how to achieve your very best health. So with that introduction, we're going to talk about, just for a moment, what are some of the benefits of a healthy lifestyle. I think we're all familiar with many of these, but when you're living it, practicing the things in your life that just give you the optimum health, whether it's our diet and our exercise and all of these little things as we do them together, it gives us these kinds of benefits. Certainly we will feel our best. You will look your best. And it gives you more energy to enjoy life and do the kinds of things that you want to do in life. It helps you to cope better with life when we have the energy and we're feeling better. And so we deal better with stress in our life. And certainly it can prevent many serious diseases. We'll look at a lot of research that shows as we adopt this lifestyle practice or that one, it can make a major change and improvement in our health. And lastly, of course, it helps you to enjoy a longer life and better health all the years of your life. So, how do we participate? There's many ways you can participate in this program. You may have joined a class offered through your church or a community program, through a business, a school perhaps, or you may be attending a small group in a home, and many people do the class that way. However you participate, you'll all learn the same information and practice the same lifestyle changes, and we have a book that will also be used in the class. And this book is geared to go right along with the presentations we're making, has additional information, has assignments that you can do and complete, lifestyle assessments that you can do, a variety of things to help you in your goal in this program. Each week there will be lessons as we cover each topic. The same topic will be covered in the workbook, and you can go back to that workbook and go through it and review the things that we learned in the presentation. There's a place for you to log your weekly achievements, a place to keep track of your exercise, miles that you might be walking, your weight, any nutritional changes that you might be working on. And the idea of logging helps to fix these things in our mind. It gives us something to look at each week to evaluate how we're progressing, and so that's built into the program. There's also a health assessment at the beginning of the program that you can take. There may be some quizzes to see how you're learning, and all of these are designed to help you learn what we're talking about to achieve your very best health. We also suggest that we have a buddy system. Whenever we're doing a new project, it kind of helps if we have a buddy to work with, doesn't it? Someone we can talk things over with, maybe exercise together. We kind of check up on one another to see how we're doing. And then, of course, there comes the practice session. Each week there will be what's called Be Well challenges at the end of the chapter. There will be a whole list of things there related to the topic that we've talked about that recommend that you try some of these during the week. And of course, if we really want to make progress, if we really want to tune up our bodies to the very best health, we need to try a lot of different things, don't we? And so we encourage you to look at those at the end of each chapter, try some of those Be Well challenges. We also suggest that during this series that you choose one special thing that you would like to change in your life. Maybe you would like to lose 10 pounds. Maybe you would like to start an exercise program and you've been thinking about that for a while. Maybe your blood pressure is a little high, or your doctor said you need to lower your cholesterol level. Whatever it is that you're working on, you might take that as the one thing that you're going to zero in on during all of the different presentations that are made. Keep track during these weeks and see how much progress you can make on that particular one. So that's kind of how our program works. Here we're talking about our daily progress, logging it in again. And sometimes people say, well, why do I need to do this? Well, there's something about it that if every day you just take a few minutes, just take very long, and I've been doing this my whole life. Every night before I go to bed, I put down how many miles I completed or how many steps I completed that week, anything new that I'm working on. I might check my blood pressure and see how that's doing. I jot down my weight, and that keeps these things in focus in my mind so that I'm thinking about it. What are my goals? How am I achieving progress towards those goals? And all the research shows that when we do this, it helps us to be more likely to succeed in our goals. One more principle is being persistent. People who accomplish things in life are persistent. Sometimes we might feel that our willpower might be slipping a little bit. And so that's a chance to contact your health buddy, talk things over, see about what ideas they may have to help, whatever maybe you're dealing with. Go back to the class materials and review them, look them over again, and maybe even seek an advice from someone you know who has achieved that goal. Maybe you know someone, a family member, a friend, who started an exercise program, who's lost weight, who've lowered their blood glucose levels and their hemoglobin A1C levels and so on. And sometimes it's nice to talk to those people and say, well, what did you do? How did it work for you? And so that's important. So it's important to remember, you'll only fail if you quit trying. And as long as we keep trying, keep working at it, recognizing that we will make mistakes, that's okay. But as long as we keep trying, we will succeed. Here are our 5 proven tips for making changes more successful. Number 1, of course, is choosing things you really want to do. It's not what someone else wants you to do, but something that you would like to do for yourself. We're more likely to work on that goal if we want to do it, isn't it? So think about things that you would like to make changes in. And then, of course, we need a plan, don't we? It's kind of like a map on going on a trip. Here are the things I'm going to do. And in the presentation, we'll outline what research shows. Here are the things that's most important if you want to make this change and make it successfully. And you might want to jot those down, work out a plan for you in making those changes. We talked about taking one major goal that you want to work on and work on it the whole time. You can't make all the changes immediately. Each week we'll give you some small things to work on each week and practice, but you may want to have one special goal that you work on during this series and focus in on that, and it helps you to be more successful. We talked about the buddy. The buddy can help give us ideas. It's also helpful to have someone to report to. And they say, well, how are you doing? How's your exercise program coming? Well, I didn't get out yesterday. Well, why don't you come and join me today, and we'll exercise together. So we can encourage one another. And for this reason, many times the best buddy might be your spouse, or it might be a child, or a next-door neighbor, or someone that you work with, but someone that you have contact with frequently that you can talk to and encourage one another about it. And then, of course, if you need further help, asking for help is not a sign of weakness. It's actually a sign of strength. It might be a doctor, it might be a dietitian, it might be a health counselor, a coach, someone at the fitness center that can help you. It might be your group leader that you're taking the class with. So if you need extra help, ask for help. There's always people that are ready and willing to help. Now, a few things as you're starting your program that you'll find in your book. There will be a Be Healthy lifestyle assessment there that we'd like to encourage you to take. It's just a few questions, but it kind of documents how we're doing on our exercise and our eating habits, and maybe how we're coping with stress in our life, and how happy are we, and some of these kinds of things. And it establishes a baseline. So when we get to the end of the series, it's fun to go back and take that again and see how you've progressed. Now, you'll have a lifestyle score, and that score goes between 5 is the minimum and up to the maximum of 27 points. And depending on how much you exercise, or how careful you are with your diet, or how your weight is doing, you get these points. And it's fun to see. This gives you an objective number on your lifestyle, some number between 5 and 27. Here's where I am now. And then again, as you go through the series and get to the end, it's fun to see that number improve. And a few of you may even reach perfection. Get a score of 27. We'll see. Anyway, that's what we're working towards in that goal. And look at your number. That same lifestyle score then can also help you. You'll find a way in the book that you can calculate this to find out your health age. How old are you really? Now you see, if you're living healthfully, you're aging more slowly. And so your birthdays, you might say, well, I'm 45, but your health age may say, no, you're really 40 because you're living more healthfully. Or it might be the other way. Maybe you're not taking such good care of your health right now. Instead of being 45, you're really 50. In other words, you have the same, based on your health practices, you have the same health as a person who's 5 years older than you. So that's kind of motivating, and it's fun to see. How many years can you add to your life as you go through? I might add, these are numbers that is based on actual studies, a large study of over 100,000 people followed for over 30 years. They looked at their health practices, saw how long those people lived. We compare your health practices with that study group and actually project your longevity, how many years you're going to live, and how old or how young you really are. So that's kind of fun too, isn't it? And there's a place in the book to write down your buddy, maybe their phone number, their email or whatever, to stay in charge, stay in touch. And there's a page 6 in your guide that says your starting health information. And again, this is documenting where you are now. What is your weight now? How much are you exercising? If you know your blood cholesterol level, your blood pressure, your hemoglobin A1C levels, as much of this information as you know, there's a place to jot that down. And again, the purpose is to see, as we give this a challenge for these few weeks, to see how much change you can make. And it's fun. I've done this with many groups, corporation groups, all different kinds of groups. And it's fun to see at the end of the series how much change have people made. Some people say, well, I've got 2 or 3 notches less on my belt. Someone else says, well, I've lost 15 pounds. Someone else says, well, I started an exercise program I didn't do any before, and now I'm doing 10,000 steps a day. Whatever it is it might be that you're working on. And it's fun to hear those changes, and people get excited as they see those changes. So choose your wellness goal, write down your health information. Those are the things we all need to get before we start. And then we're ready to jump in and talk about health and wellness, what we can do. So let's get started. Think of it as fun in doing your new health adventure. It's not something that you have to do, it's something we get to do. It's fun to think about ways that we can improve our health. And certainly if we feel better and we have more energy and we're sick less often, that's a very positive thing, isn't it? So that should be something we look forward to. And remember, the changes we make can add years to your life. We'll show you many, many slides of research that show us when people put that health practice into practice in their life, it can cut their risk of very serious diseases many-fold times. So we'll look at those. First of all, good health is a choice, isn't it? It's not something that just happens. It's usually because of choices that we've made. And every day we face choices, whether we're going to get up early and go for exercise perhaps, choices in our diet, choices of different things throughout the day, whether we smoke or not, whether we drink or not. All of these are in choices that are very important to our health, aren't they? So we're going to be talking about choices. I like this verse from Deuteronomy, where Moses is giving his address, one of his final addresses to people while he was in the Bible getting ready to enter the promised land. And he says here, I set before you life and death. Those are pretty extreme choices, aren't they? Choose life that you and your offspring may live. And so I encourage you to think about that too. As we make choices every day, the choices we make can improve our life or they can harm our life. They can add years to our life or they can take years away. I also like that verse in John 10:10 where Jesus says, I have come that you might have life. And what kind of life? And abundantly good health. And that's what we're working for in this series. As we do go through this series, we'll be looking at health research and longevity. And I'm going to focus in today particularly on 3 large studies that were done on large groups of people where they looked at their health practices, they followed them for many years, they identified what are the health practices that make a difference. You know, there's a lot of theories, there's a lot of philosophy, but where can we show that as people who do these health practices, they live longer, they have better health, and that's what we want to identify as we go through the series. And we'll look at these in more detail, but first one was the Alameda County study done in California, Northern California, where they had nearly 7,000 people. They asked many questions and looked at their lifestyle and then simply followed them for a period of many years, 7 years in one study, 9.5 years in another follow-up. We'll look at the data from that. They found some very interesting things. They found 7 practices that were good predictors of longevity. Then there's the Adventist health study. Maybe some of you have been participants in that. I know I am. And they've had 2. They've had an early study and a later one. I'm in the later study, the Adventist Health II study, nearly 100,000 people, and they're following them and looking. And again, they found some very interesting things, that when people do this in their life, they live longer and have less heart disease, less diabetes, less likely to become obese, and so on. So a very interesting study. And then the last one is Harvard's longevity study, perhaps one of the most careful ones that's ever been done, where they have over 130,000 people, and they follow them for over 30 years. And it's based on that study where you calculate your health age when you do the little lifestyle assessment in the program. So let's look at some of the results. Here are the 7 health habits that they found in Alameda County study. 7 things that were good predictors of how long people lived. Getting regular exercise. By the way, that was the number 1 thing they found most important for living a long, healthy life. Eating a healthy breakfast and not eating frequently between meals. Something about starting the day out with a good breakfast. Those people that did live longer. People who got their rest, at least 7 to 8 hours every night, lived longer than people who didn't. And so sleep is very important. We'll spend more time on that as we go along. Those who maintained a healthy weight lived longer. Those who didn't smoke. We hear a lot about smoking, and it certainly is a detrimental choice a person might make on their health. Those who limited the alcohol consumption. And then the last one was a simple question they asked: how happy are you? Very happy, pretty happy, not too happy. And they found that the people who were happy most of the time, they lived longer than those who weren't so happy. And so even the thoughts we think have an effect on our health, don't they? Our working of our physiology. By the way, that simple question was the second best predictor of how long a person lived, was having good mental health and being happy has a positive influence on the whole body. Now here we can actually see a chart. We'll just move in a little closer here so you can see it. And it shows mortality from any cause. And the blue charts, you'll see, are for the women and the red for the men. So let's just take the blue one first. Women, that first one on the left were those who had only 0 to 3 of the good health habits we just looked at. In other words, they weren't living a very healthy lifestyle. Those people then who followed all 7 of the good health practices are shown on the right. And notice that drop went down about a 43% decrease in mortality during those 9 years of that study. That's pretty amazing, isn't it? Wouldn't you like to cut your risk of dying in the next 9 years by over 40%? Well, that's what the ladies saw. And men, we see even a bigger change. Men have a little harder challenge sometimes in keeping healthy, but those who really do, you notice those who followed 7 of the health habits there on the right and the red, they reduced their risk by almost 3/4. What would that be? A 72% decrease in mortality. So men, choosing a healthy lifestyle can make a major difference in your life, help you to live longer, healthier lives. Now, going back to the Adventist Health Study, this was the first study that they did, 34,000 of them, followed for 12 years. And they simply compared people, in this case, to the average Californian, as compared to being a member of the church. The Adventist group has been studied many times because they encourage a healthy lifestyle, and they don't smoke largely as a group, they don't drink largely as a group, they tend to eat healthier, many of them on a vegetarian diet, plant-based diet. And so anyway, we've found over the years that they have been studied many times for living healthier. Notice that the Adventists lived up to 7.28 years longer than the regular average person living in their same communities. So by living healthier does make a difference, isn't it? If they followed all of the good health practices that they were encouraging, exercising, those things that we just looked at, eating well, and so on, they lived up to 10 years longer. So what we're talking about here may help you to actually add 12 years to your life. And you can see what they did in the diet. We found that those who ate the whole grains, they ate more fruits and vegetables. Those who ate nuts daily lived longer, and those who were vegetarians, didn't have meat in their diet, used plant-based proteins, also lived significantly longer. And then they also found that the healthy weight was a good indicator of a longer life. Regular exercise, as we looked at earlier, not smoking, of course, and not drinking alcohol were all positive things that helped them to live longer, healthier lives. They took this group then and made a special study on longevity and compared them to different nations in the world. And if you move in a little closer here, you can see in this chart, it shows the percent of men who reached 85 years or older, and we compare these different countries. Now you can see in Hungary, about only 8.2% of the men lived to be 85 or older. In Germany, a little higher. United Kingdom, a little more. Australia, up to 17%. United States as a whole, about 19.5%. Canada, a little bit higher there. Sweden, I think they have the third longest longevity of any nation in the world, and they were up to 20. And then the country that has the best longevity of any nation in the world is Japan. 23.6% of their men reached that goal of 85 and above. But notice that Adventists as a whole, because we live a healthier life, 41%, almost twice as many men lived to the age of 85. And if they were Adventist vegetarians, nearly half, 48.6% of them, lived to the age of 85 and above. This was reported in the Archives of Internal Medicine, and the researchers made the statement that Adventist vegetarians have the best longevity record of any group studied in the world. Maybe you've read about the reports of the National Geographic where they have the blue zones and they have the different zones around the parts of the world. And of course, one of those blue zones, the only one in the United States, is Southern California, in Loma Linda, California, where a large group of Adventists live, and many of those people live to 100 and above, and they have been studied and recognized for their longevity there. So what we're talking about are things that we've practiced in the Adventist Church for many years. We'll be sharing those principles as we go through. The third one here is the Harvard study, and we're looking at, this is the research article, the impact of a healthy lifestyle factors on life expectancies. And that's what that assessment you do, you can find out your life expectancy based on that research. They had 123,000 men and women up to 34 years of follow-up. Very long, very large study, very carefully done. There were 5 major things that they found that were the best predictors of longevity, being exercising again at least 30 minutes or more per day. Those who exercised more actually lived a little longer. Being tobacco-free, maintaining a healthy weight, making healthy food choices, and in this study they had 10 indicators. And we'll look at those 10 things as we go through our series. 10 things that you can change in your diet that will help you to live longer. And then those who limited alcohol intake also lived significantly longer. So their conclusion in the research was, written by the researchers, that adopting a healthy lifestyle substantially reduces premature mortality and prolongs life expectancy. Well, that sounds good, isn't it? So we're going to zero in on those things in much more detail so we can see how it does. First of all, let's just look at this chart. We'll move in a little closer so we can see it here. Notice deaths from any causes, could be heart disease, diabetes, cancer, whatever it might be. And then along the bottom of the chart, they show the number of those 5 healthy lifestyle factors that the people met. Now notice the chart on the left has the highest mortality rate. They had 0 of those. They weren't living a very healthy lifestyle. But even if they added 1 healthy lifestyle practice, notice that mortality dropped. And every time they added another healthy lifestyle practice, it dropped again, didn't it? So again, by the time the people were down there to following all 5 of those major lifestyle factors, a 74% decrease in mortality. Now those are amazing results, isn't it? It really shows that lifestyle matters, doesn't it? It does make a big difference in the health we enjoy. So if they followed all 5, their mortality dropped. They also found that, of course, that they lived longer. Men on an average lived 14 years longer. Women on an average that were following a healthy lifestyle lived over 12 years longer. So what we're showing you here can help you to live 12 to 14 years longer, and maybe even better than that. Now, some other things they had from that study it showed too, I think was very, very phenomenal. They reduced their risk of cancer. Notice by how much? By 65%. That's almost 2/3. You know, I get a little envelope, and I'm sure you do too, each year from the American Cancer Society, asking for a little donation, help to do the research in preventing cancer and so on. And on their slip, on their little material that was enclosed in the envelope, they always had this statement. It says, most cancers are preventable. Isn't that interesting? Cancer is our second leading cause of death, but most of them could be prevented. And that's what it shows here. By doing just those 5 things, up to 2/3 of cancers perhaps could be prevented, at least from happening early in your life. Total mortality dropped by 74%, as we already looked at, and they lived significantly longer. So let's look at the evidence. There's just a summary of these first 3 large studies of things that they found that were best for predicting a longer life. Talked about getting our adequate rest and sleep, also time for relaxation and so on. We can't be revving our motors all of the time, can we? So rest is important. Being physically active, our bodies were designed to be active, and as we do that, we're in better health, physically and mentally, and we live longer. Eating a healthy diet, and as we look at the data, we'll find that primarily one of the primary things is eating a whole plant-based diet. Cutting back on the highly refined foods, the highly processed foods, and more plant-based foods seems to be a good indicator for a longer, healthier life. Maintaining a healthy weight, something that most of us here in the United States can work on, and we'll be talking about that. One whole presentation will be on key principles, things that we can find to help us to have a healthier weight. And then having a happy, positive outlook on life. We looked at that already, and that it helps people to live longer. They also found that being socially connected and spiritually connected also help people to have a better physical and mental health and live longer lives. Then the last 2, being free of dependency. The things like tobacco, alcohol, and drugs can have a major impact on our health. We'll look at that in a little more detail later on. And then, of course, the last item there, number 7, getting regular preventive health care. You know, it's important for us to do everything we can, but sometimes it's also important to go to our doctors regularly, get the preventive checks and so on, checking our blood pressure and our cholesterol levels and our blood sugar levels and so on. If there is a problem, catching it early, screening tests that can be done for cancer and so on. And if you catch those early, then there's, of course, a lot better chance that we can take treatment that will help you survive those problems and do much better. So the last presentation we'll deal with is good preventive health care. So those are our goals. Now we're going to just introduce an item or 2 on each one of these to kind of whet our appetite, get us thinking about it, and begin putting some of these things to practice right away in our life. Number 1, of course, is getting adequate sleep. Research shows that about 50 to 70 million Americans have sleep disorders. They don't sleep well. They don't get their sleep. And so it's a very big problem. And notice here it says 1 in 3 adults do not regularly get the recommended amount of uninterrupted sleep. And here's what's recommended by this is from the National Institutes of Health. They have a guide out on healthy sleep. And they say preschoolers need at least 11 to 12 hours a day. Children in school, at least 10 hours. Teens need 9 to 10 hours. That's when their bodies are growing and they need that rest. That's when a lot of the healthy things happen in their bodies during the rest time. And as adults, we function best, are most productive, and live the longest when we get at least 7 to 8 hours of sleep every day. So sleep is important. What does it do for you? Well, here's just a few recommendations that came from that same guide or benefits. It gives us better physical health. You see, in the daytime, we're in a type of catabolism. We're breaking down. We're using up energy things and so on. And at night, we're restoring energy. We're restoring, building up our immune system, all the things that we need to have good health take place at night. And so our body is restored physically. We have better mental and emotional health. And the brain works better when it's well rested as well. So we're able to cope better with stress. We're able to perform better at work. Some studies have been done with pilots, and they looked at how many hours of sleep they've got and then gave them tests. And they found that their dexterity, eye-hand coordination, and all of these kinds of things improved if they got enough sleep. Well, I know I want my pilot that flies me around to be well rested, and so that his skills are very good. I think that's important, and it's good for all of us when we're driving our cars or whatever we do. We find that people who get their rest, of course, have higher energy levels, and the productivity of that person is greatly improved. And we've all noticed that when we've been up too late and we don't get enough sleep, we just kind of drag through the day. We really don't get much done, do we? We don't feel very good, and our energy levels are low. New data is also showing that as we get sleep, we have healthier weights. And a lot of people who don't get the sleep they should is one of the causes of gaining excess weight. And we'll deal with that in our weight management presentation. And we have better memory. The brain is really affected when we don't get enough sleep. The brain works better when we get our sleep. And it's actually at nighttime when we're sleeping that the memory is made into long-term memory that we have during the day. And so if you're a student and you want to remember well, not only do you have to study hard, but we need to get the rest so the body has time to put those things we're learning into long-term memory. And of course, lower mortality. As we take a look here in this next chart, people who get their sleep live longer and have less mortality, in this case from cardiovascular disease. That means heart attacks and strokes. And notice those who get to 7 to 8 hours compared to those who get less than 7 hours. So this group of 14,000 men followed for over 12 years. Those who didn't get enough sleep had a 43% higher mortality rate from cardiovascular disease, more strokes and heart attacks. So that's a positive thing that we can do for our heart health, as well as how it affects all the rest of our body, our mental and emotional energy as well. Goal number 2 is to be more active. And the U.S. Surgeon General came out recently on a report on physical activity and health, and here were some of the things that they listed as positive benefits from being more active. You're sick less often. Well, that's good news, isn't it? As we exercise, evidently our immune system is enhanced, and we're not so susceptible to infections and diseases that we might be exposed to. It certainly gives us more energy. And studies have been done to show that the actual little energy part of the cell, the mitochondria, actually can increase by 20 or 30% in the cell, actually giving us the ability to produce more energy so we can accomplish more work. We're more successful at weight management. People who exercise, they burn up more calories. They're more active, and it helps to keep that weight down. The body can handle better with mental stress and pressures too. A lot of research shows that. And we're going to talk about a whole presentation on stress and stress management and so on. But a lot of studies show that the exercise is one of the most positive things you can do, both for relaxing the body, burning up the stress hormones and so on, and getting that relaxation stage, but also in making the body stronger so the effects of stress doesn't bother us so much. Research shows that people who exercise have less depression, simply have better mental health. And we know from research now that people who exercise, there's actually hormonal changes that take place and so on that give you a natural high, help you to feel happier and healthier, and those people have less depression. And other research, of course, that shows, we'll look at in a minute here, that they live longer. And during those years that they live, they have healthier years. So let's take a look at the Alameda County study. They noticed that in their research that for every hour that they exercised, the people lived 2 to 3 hours longer. Well, that's not bad, is it? So let's look at this study. Here we see, as we move in a little closer in this chart, this is mortality from any cause, and they simply divided people into 3 groups. Those who were inactive, and notice the red chart there, they had the very highest mortality. Those who got moderate exercise regularly, and then those who were most active. And notice that each time, as the activity level went up, the mortality levels went down. And during this 9-year study, the men who were most active, what is that, a reduction there? It looks like it cut the risk of dying almost in half, didn't it? Here we see the same thing for women, and women, it was even more dramatic. Those women who got most active cut their risk of dying during that 9-year study by about a third. So, ladies, if you want to live longer, you want to cut your risk of dying in the next 9 years by 2/3, start an exercise program. Be active every day. It's certainly good for the body. The next principle here is choosing healthy foods. And again, we'll have probably 2 or 3 presentations on talking about healthy eating. It's such an important part of our health program. But just a few principles here. As we mentioned earlier, choosing primarily whole plant-based foods seem to be the most helpful. They're very high in nutrients, high in fiber, and high in antioxidants. Protects our bodies from aging. The fiber helps to keep the intestinal system healthy and helps reduce the risk for heart disease and for diabetes and so on. And these foods, eaten in the natural state, not being highly refined, also have the most nutrients that the body requires. Foods that are free of cholesterol and lower in saturated fat, sodium and calories, also very important for having good health. And we'll look at that in detail. The foods that are best for preventing disease and promoting longevity. And we'll find that there are certain foods that if you eat regularly, you live longer than if you don't eat those foods. And it's very interesting to look at this. And then, of course, we want to choose healthy foods that are best for preventing weight gain, because most of us have to struggle with that, don't we? And actually, the research shows that poor diet is the leading cause of early mortality. So, paying attention to what we eat, very, very important. One of the first principles, and just one that we'll touch on here, is that people who eat more fruits and vegetables live longer and have better health. And you can see the list of things that it protects against. Eating more fruits and vegetables help you to control your weight, helps to lower blood pressure. Data shows that it helps us prevent cancer and heart disease and strokes, helps to reduce the risk of diabetes. It even keeps the brain healthier, so we're less likely to develop Alzheimer's disease. I don't know about you, but I want to keep this brain as healthy as long as I can. So all of these things are linked to longevity. And the recommendation, of course, on fruits and vegetables is we ought to get as many as 5 to 9 servings a day. This is what the government and the healthy diet that they recommend for most people, called the DASH diet, finds that people who eat those have less heart disease, less high blood pressure, less cancer, and they're healthier and live longer. The food guide from the USDA has this healthy plate that you've perhaps seen. And you remember on the healthy plate, they say make half of your plate at every meal fruits and vegetables. That's how important it is. So when you look at your plate and you're getting ready to eat, how many fruits and vegetables you're eating, at least half of every plate ought to be fruits and vegetables. So here we can see a large study that was done, 71,000 people, 13 years of follow-up. And again, they simply looked along the bottom of the chart there. As we look a little closer, you can see the fruit and vegetable intake, servings per day from people who don't eat any. I can't imagine that, but some don't like them, I guess. And then also eat as many as 8 servings a day. And notice each time that the number of servings goes up, mortality from any cause goes down. So that's good news, isn't it? So this chart here shows, gives us good evidence that if we want to reduce our risk of dying, one of the positive things that we can do is simply eat more fruits and vegetables. And that can be fun. There's all kinds of beautiful fruits and vegetables that we can eat that are good to tasting and good for us. Another thing they found in this study, large study, was people who chose primarily whole grains lived longer than those who didn't. The refined grains aren't the best for us. We're finding research shows that a lot of refined grains can increase our blood glucose levels and increases our risk for diabetes. That may also increase our risk for coronary heart disease, increases inflammation in the body. That's related to many different health problems, including cancer and so on. So using whole grains, and you can see a list there. Choosing whole grain breads. For breakfast, we can have oatmeal, cereals and so on that are very good for us. Whole grain rye. If you use a prepared breakfast cereal, look for one that has at least 3 to 5 grams of fiber per serving, because that will show that it is made mostly of whole grains. Instead of the white rice, the brown rice is healthier, isn't it? And instead of the white pasta, the whole grain pastas that are available we can look for. So the goal is to eat at least 3 servings of whole grains daily. And people who do that have significantly better health. Here's just one study from the Adventist Health Study where they simply took these 26,000 people, divided them into a couple of groups, those who used primarily white bread and those who used primarily whole wheat bread. And notice the difference in mortality after many years. Those who used primarily whole wheat bread cut their risk of a heart attack almost in half. Isn't that amazing? So when you go to the grocery store and you're trying to decide, do I want white bread or I want whole grain bread, the whole grain bread, and the best kind is the kind with kind of chunky grains of grain in there that's not highly ground, so that's not real fine. The little more coarse whole grain bread, very good for reducing the risk of heart disease, keeping our heart and circulation healthy. Goal number 4, as we're going through here, this quick summary here as we're starting our series, is to maintain a healthy weight. Well, what is a healthy weight? We'll look at a couple charts here that'll help us with that. And we'll spend again a whole presentation on tips and ideas and what research shows us that's most effective in helping us to control our weight. One way of evaluating our weight is called body mass index. It's kind of a complex formula based on our weight and our height. And in your book, as you get started at the very beginning, it'll give you a place where you can calculate your BMI based on your weight and your height. And you can see what your BMI is, and you can put that down as your starting BMI level. And then we'll track this during the series and see maybe if that comes down, if it needs to a little bit. They noticed here that people who had a BMI in the less than 25 lived the longest, except if you were a little older, 70 and above, people with a BMI around 27 had best longevity. Another way is to look at your waist girth. You can see the weights being measured there. And men, if you have a waist girth less than 37 or 38 inches, that's what's recommended. But if it's 40 and above, that's a sign of obesity and very high risk. Women should be less than 33 inches to be in the healthy range. If it's 35 and above, that's an indicator of obesity and, again, significant increased risk. So here's a little chart we can look a little closer at here that talks about BMI. This is in men. And along the bottom, you can see those BMI levels. And if you don't know what yours is, be sure and calculate it in your book so you can compare. And notice that the lowest those charts go means the lower the mortality. So people who had a BMI of 20 to 22 or 22 to 24.9, notice they have the very lowest mortality right at the 1. But notice if they get too skinny, what happens? Mortality goes up. Isn't that interesting? So there's that golden mean. Or if it's on the other end, which is more common, isn't it? If we get too much excess fat, then our risk goes up. And by the time you reach a BMI of 30 and above, that's considered obesity. Notice that the mortality from any cause is already 44% higher. That's a big change, isn't it? If it goes above that, it can go to double the risk or even triple the risk. So keeping the weight under control, very important thing for having a long, healthy life. Now, goal number 5, a happy, positive outlook. People who are happy, we find, live longer and certainly enjoy life better, don't they? And enjoying life's many simple pleasures is a good health principle. Good food can be a happy, good time, isn't it? We need to be careful not to eat too much. Having friends and interacting with in social groups, very important for good mental health. Listening to enjoyable music can be fun, can't it? Brings good feelings of happiness. Taking a walk in the park, watching something funny or reading a funny story and having a good laugh or sharing a funny experience with one another. All of these things have positive influences on our health, actually help to stimulate the immune system so we're healthier and we're not so susceptible to diseases. So having fun is a part of a balanced lifestyle and can help us to live longer. Here's a little research that shows this. This comes from the Alameda County study. And if we zoom in on the chart here just a little, you'll notice that at the bottom of the graph, you either have low happiness or high happiness. Okay, they divided people into those two groups based on their questionnaire. And then on the left part of the chart, we see the mortality rates, again, from all causes. First of all, looking in the blue, men, you can see their scores for low happiness. If they were unhappy, their mortality was quite high. But if they had high happiness and life satisfaction, notice they cut their risk of dying during that 9-year study by almost in half. Isn't that amazing? Significant drop. And ladies, even more so. Ladies dropped from low happiness to a high happiness, life satisfaction, dropped their mortality by 1/3, or I should say 2/3, a threefold difference. So if you want to live longer, take time to do some fun things in your life. Make happiness an important part of your life, and it can help you to be healthier. They've also found that developing social and spiritual wholeness is also important for feeling satisfied in life and enjoying life. And research has shown that a spiritual life can provide many things that has positive benefits for a successful life. We all recognize the importance of forgiveness, don't we? If we hate, if we resent, if we have these negative emotions built up in our life, it hurts us perhaps more than the person we have the feelings against. So forgiveness, very important. Religion can bring comfort during times of difficulty. It can give us hope, again, during difficult times in our life that we're going through. Good religion should bring us peace of mind. And in a troubled world, that's certainly something we need more of, isn't it? It can give us direction and meaning in our life and fulfillment as we work to help other people and get involved in solutions in the world, all of these things, part of the spiritual dimension of life, can also give us good health. And we'll look at some research on that here in our next slide. This is an interesting study of over 2,000 people who were aged 55 and up. And they asked them a whole host of lifestyle factors, and they wanted to find out what was the best predictor of longevity in this study. And they followed the people for 5 years. This was a study in the Journal of the Public Health Association. And they found at the end of this 5 years that the most significant factor predicting who was still alive was this little question that they answered: attending religious services regularly. Isn't that interesting? There's something about it that when we meet with people of like faith and we worship together, we have a good time together, that brings these positive things we just looked at into our life, and it can give us a healthier life. And in this case, was even their very best predictor of a long, healthy life. So all of these things are important, aren't they? Goal number 6, being free from dependencies. I think we all recognize that. Smoking is certainly a very serious hazard. Second leading cause of early mortality, if you look at all the factors. Remember we said poor nutrition was the leading cause. Alcohol, a big factor. We'll look at these in more detail a little later on too. And of course, street drugs. Certainly something that's not, we recognize is not good for our health, physically and mentally. So as we mentioned, smoking is the second leading cause of preventable death. About 1 out of every 5 deaths in the United States are smoking related. Isn't that amazing? 1 out of every 5. And we've talked a lot about COVID disease, and we're kind of in the midst of that as we're making this presentation here. But over 200,000 people have died from that. But it's something to put in perspective here. More than twice that many people have died from smoking-related diseases during the same time. We don't always hear the same amount of emphasis, do we? But a very important thing to be smoke-free, to have good health. Of course, smoking increases the risk of heart disease, of cancer, of stroke, emphysema, diabetes, all kinds of things, even increasing our risk of the common cold. And if you're concerned about COVID disease, significantly raises the risk for death for COVID disease. And in women who are pregnant, it also has a detrimental effect on the unborn baby. And so there can be physical and mental impairments that are caused from the mother who smokes. So avoiding smoking, of course, is something that's very important. And notice there in that one little quotation, smoking is responsible for 1,300 deaths a day in the United States. So if you smoke, stopping will make a big difference, and encouraging other family members not to start, also very important for good health, isn't it? We hear a lot about drug abuse these days. Just a couple of facts. It says there's over 20 million people that have a substance use disorder in the United States today. That's certainly way too many, isn't it? 70,000 people died from simply drug overdoses last year. And probably this year may even more, because we're going through some hard time with the COVID disease this year. So more people die from drug overdoses than die from gun violence, car crashes, and even breast cancer. Isn't that something? So it is certainly a big problem. We need to do whatever we can to encourage our family and our children to be drug-free and avoid this big problem. If you have a problem of dependency of any type, seeing your doctor or healthcare provider, get help. Addiction is treatable, and going for that help would be very important. The third item here is alcohol in your health. Alcohol's been around for a long time. The estimates are it's responsible for about 88,000 deaths per year. That's a big number, isn't it? It could be entirely prevented. And excess deaths and 2.5 million years of potential life lost per year from drinking. So we have to be very careful of alcohol. If you just keep it to very small levels, it's not such a big risk. But often happens is that will grow over time until people become dependent on it. So we have to be very careful of that. And you can see what it causes. Cancers, many cancers is caused from that. Breast cancer, particularly for women. It raises the blood pressure. And certainly has a big factor in accidents. About half of all people who die on the highway each year is from drinking and driving. And certainly increases the risk for suicides and homicides, and can have a detrimental effect even on the brain, causing dementia. So if we want to have healthy bodies and minds and be safe, limiting alcohol, I don't know for you, but as far as for me, I think the safest course is not to use any, and then it's not likely that we'll get caught in that dependency. Notice that 1 in 10 deaths in the United States is caused from adults who drink, and shortening their lifespan by up to 30 years. Those who die from an alcohol-related death, 30 years shorter in our life expectancy. So big factors, aren't they? So we need to be very careful of that. Someone has says the best beverage is water. Water is free, it's not fattening. It's the best thing we can have, and drink water in place of the alcoholic drinks, in place of the sugar drinks, the soda pop, and all of those kinds of things. And we need water, don't we? Very important for our health. And it helps to have good metabolism. As we sweat to cool us, we need water, of course, to do that. And it removes the waste. If we want our kidneys and our blood to be healthy, drinking plenty of water makes it easy for the body to eliminate those wastes. So it's the perfect drink for good health. And the goal is to drink at least 6 to 8 glasses of water daily. And of course, if we're exercising, especially in hot weather, we need significantly more than that. And it will help both physical and mental performance, helps the digestive system to be healthier, helps prevent constipation. And a lot of people have headaches that could simply be removed if they were well hydrated and drank more water. So very important for good health. And the last principle, goal number 7, get regular medical care. In addition to living a healthy lifestyle, which we've looked at, which can make a big difference, seeing your doctor regularly, getting the preventive checks and so on that's recommended throughout your lifetime, also very important for improving our longevity, giving us better health, and finding problems before there's an issue, or if we need help in dealing with some of the chronic problems that we have, the doctors can help us in doing that. And that will be covered in more detail and what preventive exams are recommended and so on in our last presentation. So just to summarize up, the good health practices study that we looked at in California, the average person they found could add up to 5 to 6 years to their life expectancy. Quite a difference. Would you like to add those years? And it's not only just how long we live, but it's the good health we have during all those years, isn't it? And those who followed all of the good health practices lived 10 to 12 years longer. And notice the last one there, those who followed the good health practices, they enjoyed a level of health equivalent to someone 20 to 30 years longer. Isn't that amazing? So that's not just how long we live again, it's also the good health that the health practices can give us during our whole life. A quick summary of the Adventist health studies, we looked at it. People who maintained a healthy weight, got regular moderate exercise on a regular basis, ate the most fruits and vegetables in their diet and limited their meat intake, ate nuts daily and whole grains, lived an extra 10 years compared to those Adventists who were overweight, sedentary, and weren't so careful in their diet. So maybe if that's some area that you can see a change that might help your life in, think about that, an extra 10 years to your life. Here was a study done by the leading doctors and researchers in the United States that came together, and they say, what are the risk factors for premature death? And a very insightful study. As we zoom in on this graph, we can take a quick look. Notice that the dietary risks, the poor diet, was the leading cause of death. About 675,000 people die each year because of making poor choices in their selecting of their food. Smoking was the second one. High blood pressure was the third leading cause of death. Worldwide, high blood pressure is the leading cause of mortality. So this is again is where we're getting our preventive checks and checking those things and making changes before they cause damage. Overweight was the fourth leading cause of early mortality in the United States. Low physical activity, about 225,000 people a year die prematurely, wouldn't have to if they simply had a good exercise program. So very important. High blood sugar, as we look about excess weight, exercise, choice of foods, very important in controlling our blood glucose levels. And so that's a high figure that, of course, leads into diabetes. Cholesterol levels being high could save, look at there, 150,000, 160,000 lives a year. And our blood cholesterol levels are largely, again, controlled by our diet and by our exercise, and making changes in those areas can bring that down significantly. Air pollution. Who would have thought that? About 90,000 people a year die from air pollution. And so it's good to be conscious of our environment, try to live in areas where the air quality is good, and help to encourage changes in our society that improves the quality of our air. Alcohol, as we mentioned, about 88,000 per year. And drug abuse, that one's a little lower. It's actually much higher than that now. It's probably up there very close to same as alcohol or higher, things that we can do. So this just gives us a quick overview, things that can make the biggest difference in helping to have a long, healthy life. So think about this. We're going to be talking about being well for life. And the best investment you can make in life is your personal health. You'll never be sorry later in life that you took time to take good care of your health. Taking time as early as you can, choosing the best health we can, gives us the best chance for a long, healthy life. And just kind of summarize here in a verse from 1 Corinthians 10:31 that I like, that makes it very practical. It says, whether you eat or drink or whatever you do, do all to the glory of God. If we make that our goal, we can certainly enjoy better health, can't we? So the next steps, we're going to be taking these presentations. You can see the different topics there, as we've just talked about, in a whole time talking about specifically ways to improve our activity, our eating habits, managing our weight, coping with stress, all of the kinds of things that we've just kind of introduced. Now, just for fun, let's take a little health quiz and to see how you do. It says at least blank number of hours of sleep are recommended daily. How many? 7 to 8. Very good. 7 to 8 hours a day. True or false? Inactive persons are twice as likely to die early versus active persons. Remember that Alameda County study? Men dropped their risk by half, and women dropped their risk by 2/3 by being active. Very good predictors of a longer life. Number 3. Every hour of exercise increases your lifespan by how many hours? Do you remember that? By 2 to 3 hours. So is investing time in exercise a waste of time? Not at all. You'll actually gain time for doing that. Sometimes people say, I don't have time to exercise. And so I say, well, you're going to have to find time to die sooner then. Take your choice. We have a choice, don't we? Number 4, people with the best longevity eat how many servings of fruits and vegetables daily? You remember that chart? Okay, from 5 to 9 servings. People eating clear up to even 8 or 9 servings a day live the longest, but at least 5 or more is recommended for a longer, healthier life. Number 5, you need to eat at least how many servings of whole grains daily for best health? We'll look at this in more detail, but at least 3 servings a day significantly makes a difference and lower risk for heart disease, diabetes, strokes, a whole host of things. And number 6, people in the ages of 18 to 65 with the best longevity had a BMI that was less than what? Less than 25. Look up and see how you're doing on that. 7, people who smoke lose over blank years from their life expectancy. Well, on an average, the research we looked at was 10 years, at least 10 years, and if they die from a smoking-related death, maybe as much as 20 years decrease in their life. Certainly not a good choice to make, is it? Number 8, blank is the single greatest cause of preventable death. Remember what that was? Poor diet. So we'll spend extra time on that one. Number 9, alcohol is responsible for about how many deaths annually? About 88,000 that could be prevented. And number 10, a healthy lifestyle can add blank years to your life. Do you remember that? Well, somewhere in the neighborhood of 10 to 12, and the big study by Harvard, up to 14 years to your life. And if you project that and take the little lifestyle assessment in there, some people could even add as much as 20 years to their life expectancy. So those are positive things that can come from a healthy life. And we hope that you enjoy this series, that you'll take time to involve and read the book and track yourself and set goals and get a buddy and work together and just have a good time improving your life. So you'll find in your book, there's this week's assignments. You can read the Getting Started section and the section we just covered, starting and developing a healthy lifestyle, complete the lifestyle assessment and see how you're doing. And then this week, they want you to focus in your tracking. And there's a little place in your book to write these down. It's every day. How many days do you get at least 7 to 8 hours of sleep? How many days do you drink at least 5 to 8 glasses of water? Not big things, but they affect our health. And then the last one, even taking just 15 minutes or more a day to do some walking, at least 3 or more days per week. See how many days this week you can do that. If you haven't been used to walking, maybe you can only go 10 or 15 minutes. That's all right. But doing that, and then gradually we'll work that up to a half an hour or more per day. So those are 3 things to check on. And of course, select your personal goal, whatever it is, that one big thing that you want to work on during this series. And be sure to write them down. And as you do that, you will find it will help you in reaching your goals. So we wish you the best, and we'll look forward to meeting you again in the next presentation. Thank you.